My name is Layla, and the topic I'll be speaking about is mental health care and the importance of maintaining good mental health. Over the past years, I've taken a particular interest in the lack of care or knowledge society has for mental health care. Mental health has an impact on everyone's life. Do you wake up one day sad and it feels like nothing will be okay? Are you ever so stressed that it builds up and one day you blow up on the people you love? Well, that's your mental health, and if not treated correctly, can be highly disabling to a person's everyday life. There are many contributing factors to mental health disorders, such as biology and environmental factors. Being aware and alert of these risk factors and the symptoms of mental disorders can make all the difference in one's mental health. A rising factor in mental disorders going untreated are primary physicians' failure to recognize mental disorders in their patients. In a study to determine patient and provider associated with increased risk of non-detection of mental health problems by primary care visits, it was observed by physicians responding to the severity of depression symptoms in a patient, and they are less likely to detect mental problems in African American and Hispanic patients. Bad primary care detection is a major barrier to receive the proper mental health care for those patients because they are more unlikely to access treatment. Detecting disorders are not always efficient. United States military soldiers who are deployed to combat zones are routinely evaluated after their deployment for mental disorders. Statistics show that even with these tests and the knowledge of having the disorders, only 38 to 45% express interest in receiving help. Only 23 to 40% reported receiving professional help. Post-traumatic stress disorder, depression, and substance abuse are very common after deployment and not only affect the soldiers, but their friends and families as well. So why aren't there more people actively seeking help? The most important factor to the untreated rate of mental disorders are ourselves. Even in modern society, being labeled with a mental disorder is not what. How many times are normally said and you haven't said a word to anyone? People don't take symptoms such as being sad, overly stressed, or even overeating as possible symptoms when they could be. People tend to dismiss abnormal emotions by rationalizing them, but they should be reporting them to a physician. If one were to wake up with a sixth toe, they would normally seek a doctor's advice automatically. But if an abnormal emotion or feeling were to show up, the chance of seeking a doctor's advice is not as likely. Mental disorders can build up over time without treatment, so the recognition of possible symptoms at the earliest stage is crucial. People need to put their health first, mentally or physically, and be active when anything abnormal occurs. Society looks at you. If awareness and the importance of maintaining good mental health were more widely known, then surely an untreated mental disorder rate must decrease, right?